Welcome back to CEEN Caribbean News. It's now time to go in depth. In the last quarter of 2015, the Twin Island Republic of Trinidad and Tobago confirmed at least 4 cases of persons dying from the H1N1 influenza, popularly known as swine flu. Naturally, the situation is causing some amount of concern in the region, especially that the virus is contributing to the loss of lives. The situation has now been described as a pandemic, but is it? How serious is the H1N1 influenza in Trinidad and Tobago, and has it spread to the rest of the Caribbean? To discuss this, we have been joined by Dr. Joy St. John, who is the Director of Disease Surveillance, Prevention and Control at the Caribbean Public Health Agency, CARPHA. Welcome to In Depth, Dr. St. John.
Thanks for giving me the opportunity to clear up some misconceptions.
Okay,
One of the first things I want to do is to tell you, stop calling it swine flu.
Okay, now
and
what?
I want the general public to know that it's H1N1.
Okay, so what exactly is the H1N1 influenza? And I must ask, how did it become widely known as swine flu?
In the very early days, because this has been around for a long time, it was the virus of the pandemic of 2009, and let me say now we're not in a pandemic. So that's the second misconception. In the early days, there was a discussion about it developing from pigs, but we're long past that stage. It is H1N1. I don't want any discussion about swine flu because there's no connection to pigs and definitely no connection to the agricultural sector. So I want that put squarely on the table, first of all.
Okay, now how is the H1N1 influenza contracted?
It's a respiratory disease, a respiratory illness. And so if you are in the vicinity of someone who is sneezing or coughing, you can contract it. That's why it's very important to practice cough etiquette, ensuring that you also do not cough, use your hands, or you sneeze and use your hands, and then touch another person or touch something that another person will touch, because it can also be passed if the droplets or nasal or mouth secretions are handled by someone and then breathed in. So that is the way that it is contracted.
Is it known how the virus entered the Caribbean in the first instance?
All of those years ago? Well, respiratory viruses, circulate in all populations. We have a lot of traffic around the world, so it could have come into the Caribbean by a Caribbean person returning from an area where there was H1N1. So it could also have been contracted by someone coming from another country where there's H1N1. The issue with H1N1 at that time of the pandemic was that it was a new virus in circulation, and the way in which it would react with persons wasn't as clear. But now it is quite clear that H1N1 will cause the majority of persons very little effects. You can have a cough or cold and you can recover. But there are some people who are very susceptible to having a very bad bout of H1N1 and are at greater risk of being ill, to be hospitalized, or even unfortunately dying. And those are persons who have debilitation. For example, persons with more than one chronic disease, persons who are obese, the elderly, and also pregnant women. And that is why H1N1 has been part of the annual flu vaccine for some years now, especially since 2009. What happens every year, there's a flu vaccine produced based on the most prevalent circulating viruses. And so these viruses are part of the vaccine. H1N1 has been part of the flu vaccine, and therefore people who are at greatest risk are being encouraged to have that vaccine.
Now, Trinidad and Tobago has confirmed the presence of the virus on its shores, and the media has been reporting that the virus has contributed to at least 4 deaths in late 2015. What can CARFA confirm about the situation in Trinidad and Tobago?
CARFA can confirm that as a reference laboratory, we have been doing testing not only for Trinidad but for other countries throughout the Caribbean. And there is H1N1 circulating in more than one country in the Caribbean. It is very unfortunate that some of these deaths have been linked to H1N1.
And how is CARFA responding to the level of fear that now accompanies the presence of the H1N1 virus in the Caribbean?
We are currently doing what we've been doing since last year, even before I joined CARFA in October. CARFA was issuing first information to ministries of health about what was circulating in terms of the different types of viruses. We were also issuing information that the ministries of health could use for strengthening their own health services and also for detailing public and private sector physicians and health providers about the best ways in which they could treat persons who were ill, or some of the treatment protocols and referral protocols if it was necessary to the hospitals. We have also been issuing general information to the population, things about cough etiquette. We maintain information flowing to the ministries of health. As I said, we've been doing testing for different countries. So we make them aware of if they have issues with H1N1, not just from the perspective of having it circulating in the population, but also if they're seeing clusters of outbreaks, for example, in institutions like nursing homes. If you're seeing evidence of more than one person having flu-like symptoms, we keep them apprised as to if it is H1N1 or not. There are other circulating respiratory viruses that have been causing illness, and so it's very important for CARFA to keep countries and ministries of health aware of exactly what is circulating.
Now, Trinidad and Tobago has been so far the only country to confirm the presence of the virus on its shores. Are you able to tell us where in the Caribbean the virus may also be present?
And so I will let you know that Caribbean Public Health Agency will give you information about a particular country once the country itself has announced. And I will leave it at that.
Thank you very much for speaking with us, Dr. St. John.
You're welcome.